record. All right, so we're recording, and hello, you guys know me. This is Mr. Lavery, and Mrs. Dampf joined us with a former student, a big fan of ours, and we're a fan of her, Amber Kilkenny. Amber graduated almost 10 years ago, and we've kept in touch. I taught Amber in Allied Health and Allied Health 2, and as she could probably tell you, the Allied Health 2 class then, just like now, we drove each other crazy. But like, it was one of those things, like, we could all be friends, and that's probably why we drive each other crazy. And so Amber was really into medical terminology, and she became a medical assistant through Allstate in Essington. So we're going to talk about that, being a medical assistant before COVID and after COVID, and HIV-related topics, how it's touched her family, and intravenous drug abuse and safe injection sites. That I got to remember to say it appropriately. So Amber, can you tell us about your experiences in Allstate, the pros and cons?
Yeah. The only cons is because, like, it doesn't really, they do their best at preparing you for being on the job, but there are some things that, like, you are just never going to be prepared for, and you just got to live through them to learn. So, like, we focused a lot on, it's only a 9-month program. So every couple of weeks they go through different types of topics. Like, we have a medical terminology course, and we have anatomy and physiology. We have some courses on billing and coding, which I don't use a lot. And they do make it clear that when you start out as an MA, you might not be in that clinical spot right away. You might have to improve yourself in the work environment. So when I started, I was a front desk receptionist for the doctor's office, and I stayed in that position for months. And I got pretty lucky because the woman who was the medical assistant for the doctor that I was working for unfortunately injured herself on the job, and instead of getting treatment and recovering and coming back to work, she just left and never came back. So I filled her spot, and I learned a lot from that position. Do you want me to talk more about, like, school or more about the job?
So, like, at this point, you know, considering the current climate in education and the workplace, and with COVID-19, do you think it's worth the money to get through that program in 9 months?
Absolutely. Absolutely. Okay. I'm in nursing school right now.
Okay.
And I think being an MA, especially.
You froze. You froze right there. So can you say that, being an MA?
Yeah, being an MA in the urgent care setting, and even in a doctor's office setting, has really prepared me for things that I'm going to encounter as a nurse. So my role in urgent care now is functioning as a clinical lead. So by clinical lead, I do everything an MA does. I take them back for the physician assistant, the patients, do the vitals, triage, and I also learn to deal with emergency medicine a little bit. So if someone comes in and they're in anaphylaxis, their throat's closing up, we have cardiac kits and we have anaphylaxis kits. So if I know that, like, you know, someone's like, oh, I can't breathe, and they're swollen and they're, like, covered in hives or something, it's my job to go out there and take them back immediately and start making them comfortable, to alert the provider, get epinephrine in them, get Benadryl in them, and start an IV, which is also cool because generally MAs don't get to do stuff like IVs.
That is really cool. That's great.
My setting, I've taken classes and I've learned how to do IVs.
That's awesome.
And I learn a lot there that's going to prepare me for being a nurse. And when you graduate from nursing school, you know, it's anywhere from like 2 to 4 years, depending on you're getting an associate's or a bachelor's. And you're kind of just thrown into the workforce with no experience in the medical field. So for me, I mean, I've been an MA for going on 6 years now.
That's
and
great.
There is so much that I've learned, and I've moved up so much. I mean, I got lots of practice in phlebotomy, and not even just the clinical skills. Like, I mean, I learned so much knowledge regarding, like, medication and Perfect example, we had a patient come in for a laceration. So protocol with lacerations is to give them a tetanus shot if they're not up to date. And this person was not up to date, but she had a drug allergy to a preservative called thimerosal, which is in a lot of vaccines.
Okay.
And from my practice in the field, I was able to recognize the provider was about to give them a thimerosal or a tetanus shot.
Right.
Where that thimerosal was a preservative in tetanus. So the provider ordered the tetanus, and I was like, you know what, this doesn't feel right. Let me just check. And I looked up the ingredients, and lo and behold, thimerosal is an active ingredient in tetanus. So if I gave that patient that shot like the doctor ordered, they would have gone into anaphylactic shock.
That's awesome. Good job. I'm proud of you.
Yeah, you saved a life. I do have a question. So is it the Allstate program?
Yes.
Mm-hmm.
Okay. So you're in nursing school now, probably sitting side by side with students who didn't go through any kind of program like that. So do you feel like you're well ahead of your classmates, or just your life is so much easier than theirs?
Well, not so much easier. So like I still have a couple of prerequisites I'm taking, but as far as things like knowledge of medications, knowledge of drug reactions, knowledge of like just basic clinical knowledge and vitals and everything like that, I definitely have an upper hand because I do it every day. So like, I mean, it definitely, being an MA, I feel like I do have a little bit of an upper hand because I have these 6 years of clinical knowledge and experience that some of these people might not have.
Right. Where are you at? What school are you in?
Montgomery County Community.
That's great. That's awesome. Ms. Dampf's hood. Do you think, looking back, you were able to get your feet on the ground really quick by going through Allstate. Do you think, like going to the community college to be an MA, would the credits have transferred better? Would that made your life easier? Or, it's working out well for you, but is there anything you would?
My specific situation was weird. And I think it all depends on who you are and what you're going through. For me, I had actually started out at community college for nursing.
Okay.
And I had some life events. I lived with my great-grandmother. I was 18.
That's right.
Her health was declining. So I was a part-time cashier at CVS, and I needed to get out and make good money and get in my field as quick as possible. It was the way to do that for me.
Yeah, I remember that. I remember you were at the CVS at 420 McDade. I would stop by from time to time. The Charlie's is no longer there, so I don't go by there as often. They moved the Charlie's. Your life, like you said, it was a different situation. Can you, since we're talking about HIV in class, can you describe to our students how your life has been touched by HIV?
Yeah, so I started to learn a lot about HIV when I was in 8th grade. We were going through it in class, and ironically enough, at the same time, my father, who I hadn't had a lot of contact with, called me and broke the news to me that he had HIV, and his health was declining rapidly. He did not die from HIV, but and of course we learned in your class, you don't die from HIV, you die from a disease that you get while you have HIV because your immune system's compromised. And, but I mean, that was heartbreaking for me. And I definitely wanted to dive in and learn as much about it as I could. So, I mean, as you know, for my senior project, I started to raise funds for the And that was so rewarding. I mean, it was rough because it was a 12K and I was morbidly obese, so I was not fun, not a good time. But I met a lot of cool people on the walk there and a lot of awesome stories. And there's so much stigma and hate with HIV that I think needs to be changed. And even my second job as an MA, I worked with an infectious disease doctor. Okay. And I worked with a lot of HIV positive people. And I even had a couple of scares, draw blood on these patients, and I came into contact with someone who has HIV and their blood. So I had to go to an urgent care, get screened, get shots. the whole 9 yards, but I ended up being okay. And HIV isn't like, you know, it's not a death sentence as much as it was back when it first started coming out. But it was definitely different for me because, you know, there's someone, you know, you can't, I couldn't be scared to hug my dad.
Right.
So, like that's a huge misconception. And when you learn about HIV, you learn that it's primarily spread through those bodily fluids like blood and everything. And the treatment for HIV has come such a long way. And some of the patients that I saw had their counts so low that it was virtually, they couldn't transmit it because the medicine lowered the count so much that it was almost undetectable in their blood. And so these people can now get on this medication, which it used to be large amounts of drug cocktails and multiple medications a day. Now people can live normal, healthy lives with HIV on one pill a day.
Right.
And that's,
Mm-hmm.
I mean, it definitely made a difference for me and like learning about it. Like once, like I said, once I found out that he was diagnosed, I topic and decided to learn about it and educate myself. What is safe for me to do? What is safe for me to be around my, can I hug him? Can I kiss him? Can I share a drink? Can I not? Like, you have to be careful with those type of things, but we learned that if you hug someone or kiss someone with HIV, like you're not going to get it. So it's not as scary as it might.
Ms. Dampf, do you have any questions? I have some follow-ups, but are you good? Yeah, we're good. All right. So, well, that's what the everything, blood, sexual fluids. And one of the things, like you said, it's not like it was, and it's not a death sentence. It's not a death sentence. We're seeing it creep through society, especially with other STDs and bloodborne pathogens. Philadelphia was like in the top 5 for a while of increases. And like if we were in class, I'm still using the same basic worksheets as jump starters, and that's what they're doing online now. And we would talk about how definitely with the lack of fear in society, Viagra, dating websites, everything's making a big comeback. But now the scourge, and up until right now, was definitely the drug abuse and those addictions. And we're trying to change the stigma that they're not bad people, they're addicted. It's a disease. One thing led to another and spiraled out of control. And you did some interesting research that you shared with me, which I'm thankful for, because the United States is behind in this area. Safe injection sites, it's not for everybody, but can you describe your research into that and the pros and cons of safe injection sites here in the United States?
Absolutely. So safe injection sites, safe injection facilities, whatever you want to call them, are getting a lot of backlash. People believe that it's a way to enable the addict, and it's like, however could you give an addict drugs and enable them that way? Tell them, here's a safe place where you can go shoot up. But that's not necessarily the case at all. You know, these facilities have proven to work in other countries. Don't quote me on this, but I think Sweden was one of the first ones to have them, and it worked out great for them.
It's worked for Portugal too. I read about it in Portugal. Go ahead.
So like in high populated drug areas, specifically Kensington around here to relate to that. So what these safe injection sites do is these addicts can go possibly get their drugs tested for other drugs like fentanyl, and to make sure they're not going to overdose. If they do overdose, there's trained medical professionals on the scene ready to intervene with Narcan, which is that overdose reversal drug. And we also carry that at urgent care just in case. And it's a great argument against that it's free treatment for an addict, when it's not. That's not the case at all. And overdose on drugs and someone calls the EMTs, they call an ambulance, the EMTs come in, and it's their job to revive the patient. The same thing where as if someone with high blood pressure was sitting in their house and had a heart attack an ambulance was called. They do what they can to revive.
Right.
Narcan is meant for the underlying disease. It's just a mechanism for revival of the patient. So these professionals in these facilities are equipped with drugs like Narcan to possibly revive somebody in the case of an accidental overdose. And not only that, but it cuts down on the preventable diseases like HIV, because they're given clean needles to inject with. So that is one of the primary things. And if you don't mind me saying, my dad actually contracted HIV from a dirty needle because he was an IV drug user. So that's how he got it. And that's a big problem. And that was a big part of the spread. And so if people go to the more people that go to these safe injection clinics who are IV drug users, it dramatically cuts down the risk of preventable diseases. And it's not just HIV, it's also hepatitis C and stuff like that. So there's so much good that it does, not to mention it also takes drugs off the streets. In our own little slab of Delco, Ridley Park, I remember walking to work and passing by so many needles and syringes littered on the ground. And these are often in schools. Just what I think it's like Lady of Fatima or something on I forget what church it is. It's on I don't know what road it's on, whatever. It doesn't matter.
Okay.
But the church in Delco, and kids go to school there, and just like the surrounding areas are littered with needles. So safe injection clinics also eliminate the problem of needle litter. And your little infant or your child or your teenager running around and coming into contact with one of these needles that could possibly be contaminated with something like HIV or hepatitis C. No one with a dirty needle. So
I know. I sorry for interrupting, but like I know somebody who lives in the neighborhood where they proposed the safe injection site in Philly, and he and everybody in that neighborhood is up in arms because this is going to bring the drug users to their neighborhood, and it's a horrible thing. And it's what you're saying, it's there, they're just not seeing it in plain view. But I did have a question. If there has been data released about like crime statistics in Sweden or Portugal where these things are in place.
Well, that's go ahead.
No, you can go. It's cool.
Well, Portugal was a big movement years ago. They decriminalized drug addiction. So there, in a lot of ways, and that's why I was reading that when Amber asked me to proofread her research paper on it. What'd you get?
You both read that way.
Oh, you did too? That's great. Did you get an A?
I did. I got an A and I passed the class.
Hey! So like that idea of, in the United States, there's still a criminal element we associate with the addiction, and we associate it with poverty, when the people with money are just as likely or more likely to be addicted to drugs because they have the money, and then they spiral. I'll let you take off with the data.
Not that these people are criminals to begin with. Like no one's set their brain like, I'm going to do heroin one day and ruin my life. Nobody does that. These people aren't criminals. They're sick and they need help and resources. And safe injection clinics are another great way to do that, because when you're in a safe injection site and you're talking to medical professionals and you're an IV drug user, the door is also opening for you for recovery. These people from recovery give information on meetings, on great groups like NA and NA. They open that door for them and they make it available. And all the meanwhile, not for nothing, both my parents were IV drug users. And, I lost my dad and I lost my mom just this past November to a heroin overdose that had too much fentanyl in it.
Sorry.
So thank you. I feel like if there was a safe injection clinic at her disposal, not saying she would have gone there, she might not have, but that could have prevented her death and I might still have my mom,
And I'm so sorry. So back to the data question, and that's a big step. I don't think Amber and I are prepared to answer that right now. I will look it up though. Yeah,
that was a social studies question. Sorry.
that was but it's an interesting question because every day I'm looking at the data for COVID. Like I'm as somebody raised in science, I'm driven towards the data, and that's something we just don't have on the tip of our fingers. And
right. I've actually, because I did read Amber's paper, but I was really familiar with this topic for that. Because I listen to podcasts. I love podcasts, and I listened to several on the drug epidemic here. And where this is in place in the world, it's shown dramatically great results. And even like you were saying, Amber, with having the counselors on hand, just talking to somebody who kind of understands what the drug user is going through, oftentimes what the data has shown is that they are more willing to go into therapy and to accept treatment than having, say, like a family member who's not used, doesn't really understand what's happening. So I think, personally, I think they're really powerful and positive things.
Absolutely.
And Amber, that's one of the reasons why we're talking to you today, and I'm going to share your story with our students, is because, you're a shining star. You did not have a silver staircase. Your parents were not bad people. Look what they gave us. They gave us you. And that's another reason why you're such a successful medical assistant and will be successful in healthcare. And you're good for people because you understand and you can empathize. So here we are now, and you're experiencing COVID-19, another scourge. And I even proposed to my students, well, AIDS used to be called the modern plague. Maybe not anymore. It might be COVID-19 takes that right out from underneath HIV, and that's not some place we want to be. Can you, when we first got on, you were describing your experience with COVID-19. Can you describe that experience to the students now?
So fortunately, I mean, I've been fortunate in the fact that my my urgent care site is not a COVID testing site. So I got lucky with that, but I have been exposed a couple of times because unfortunately patients don't like to read signs and follow rules. I will tell you that I've gotten in a lot of Facebook debate. And if someone walks in my clinic without a mask on, they are leaving without treatment or putting a mask on, and there's no argument about that. So people have come in and an array of different symptoms. We've had people with the loss of the taste and smell. We've had people with the fever and the shortness of breath. And we've had people even so specifically a male in his 60s came in to the urgent care, and he was without a fever, so he was allowed to be seen at our site. He had told the front desk that his experience was he had a sinus infection and a cough back in December, was seen at our clinic, and he thinks that it kind of just never left, and he's got the same thing. So when I got him in the room and was going through my history, I come to find out that that wasn't the case, and that he was here in December, but his symptoms completely resolved. And 2 weeks prior, he decided to go on a hunting trip to Georgia with his 2 sons who had fevers. This man had nothing but like a little cough, and that was like his only symptom, and like a scratchy throat, and he tested positive for COVID. So, I mean, I was exposed to that, and that happened a couple of times because people aren't taking this seriously enough, and that's a huge problem. And I've been a huge advocate for that. And the fact that I want to educate people as much as I possibly can. I don't have all the answers. I'm not a virologist. I'm definitely not a doctor. But I do work with very reputable physicians, and I do go to the CDC, the Department of Health, and the WHO for my facts. And that's where I get my facts. And that's where my lies, is with facilities like that, because they're the people who know what we're dealing with. We've never before seen something like this as a society, and people can compare it to the flu all they want. Sure, the flu kills a bunch of people a year. For the flu, though, we have a vaccine and we have treatment, a drug called Tamiflu, which helps people out with that. Sure, the flu still kills many people a year, but we're learning that COVID attacks every major organ system in the body. and that's a huge problem. There are young in their late 30s and 40s in New York who are dying from massive strokes due to COVID with no underlying health conditions. I read an article of a doctor who was removing a blood clot in the brain of a COVID patient who had one of these strokes. And he said in real time, he saw new clots forming around the clot he was breaking up. And that's like something he'd never seen before. So that
is the most messed up stuff.
Right? It's scary. It's horrifying. And I mean, when it comes down to a topic like ethics, when you're talking ethics, sure, the virus may only kill people who are elderly or with really bad health conditions, but if you're okay with going out and possibly killing one of those people by giving them COVID, then that's a you issue. And that's something that you need to work on.
It reminds me of
that's
something
incredibly selfish, and I think that's incredibly.
Reminds me of something I used to say in class: practice safety in all aspects of your life. Buckle up in all aspects of your life. And, you know, we used to talk about how someday we might be wearing eyeglasses and masks every day. And here we are. Those discussions, unfortunately, are unfolding. Are you busier or slower now?
My site specifically is a little slower on average. But what we are finding is on our busy days, there are more people like coming in for silly things, like they were chopping an onion and sliced through their hand, or the kid was running around the living room and bonked his head on a table. And because everyone's home now, or
right.
Most people, if not home, they should be home or limiting their as much as possible. But we have seen more cases for that. As far as our COVID sites go, I think we have 6 in the region. If anyone needs to go get tested for any reason, there's one in Plymouth Meeting, Tower Health Urgent Care. Little selfless promotion there. They are incredibly busy and seeing a max. So we work 12-hour shifts, and in the course of 12 hours, they can see up to 50 people. That's a big inflow. And for us, when we're not in the midst of a global pandemic, our numbers are generally around 25 to 40 patients per day throughout 12 hours. And that's decreased to anywhere from 0 to 15 patients a day on site. So it gets a little boring.
Well, I'm glad you have a job, and I'd rather you be bored than sick. So I'm glad there's the pop-up sites, pop-up clinics are helping out. I know the CVS's on the 420 corridor are now testing. And do you have any questions related to these topics before I stop recording?
Well,
no, or unless Ms. Dampf does.
Well, I think, yeah, I was going to ask, like, how do you convince people to follow the CDC when they're getting so much mixed messaging from the government, frankly, and from their echo chambers in social media? Because I think one of the biggest issues here is, like, we are quarantining. I'm not seeing sick people, like, because I'm at home all day, and it doesn't seem like a big deal. Like, if I'm looking at it without reading data and really thinking critically, especially, I think, like, the biggest thing about this disease is that you can be asymptomatic and carry it. And I think people forget that, because I'm constantly seeing people make reference to this to any other flu epidemic that ever happened. And correct me if I'm wrong, but is that the big difference between this and everything else as far as passing it on to other people, right? Is like, I could have it right now and be wholly unaware.
And actually, that's the commonality between HIV and this. Even though the time spans are different, the carriers are just moving and spreading.
You can have it for 10 years and have no idea until you get sick.
So Anne's question was, so how do you educate these people?
So I try and do my best by sticking to the facts and trying to, like, think through things logically by explaining, okay, like, you feel fine. You don't think that you should be in quarantine because you're a healthy individual. but you don't know if you're a healthy individual because so many people are asymptomatic. And not only that, we don't have enough tests. We don't have good enough tests. And people are coming up with false positives and people are coming up with false negatives. So there's almost no way to know if you have it. And I mean, that might not be a huge problem if you're not symptomatic, if you're not coughing, into the air and people aren't breathing in your droplets, whatever. But that's why we wear masks. Are they 100% effective? No. But the odds of you passing it to someone else if you're wearing a mask and that other person is wearing a mask are a lot less likely. And obviously it's also a lot less likely if you're sticking at home. And if you think about it, the terms of like chain of infection, so like, maybe you sneeze into your elbow and you go to the store and you have COVID. So you've just sneezed into your elbow. And like, if you brush, if those COVID germs are on your elbow and your elbow comes into contact with another surface that another person touches, and then they touch their face or they fix their hair or they rub their eyes, and now that person is possibly infected.
Right.
And I think about that all the, like, I mean, I'm not being too crazy, but like when I go out grocery shopping, I carry a wipe or a napkin with me. I don't wear the gloves because it's easy to cross-contaminate.
Right.
But
I bring a stylus.
there you go. That works. Things like when I'm in the freezer section, I'm opening the door. I grab the product and I grab the door with that cloth because I don't know who touched that door before me.
Right.
And the staff can be so thorough. Like, I mean, they don't have time to run around and sanitize every door after everyone touches something. Which is why stores like I've been to Wegmans a couple of times and they're doing an excellent job. You're not allowed in the store without a mask on. They have distancing markers. Only a certain amount of people are allowed in the store at one time. The only problem that I have, a lot of the employees are wearing gloves, and I tend to be educating a lot of people about proper use of PPE because a lot of people are very uneducated on that topic.
People are just wearing them and they're not taking them off.
Yeah, I saw, you know what, I went grocery shopping the other day and I saw a woman drive by me and she had her mask on in her car and gloves and she's talking on the phone with her gloves on. And I wanted to be like, lady, hello. I don't understand it. But I mean, the biggest problem is that some of these people aren't educated. They don't understand that they're doing something wrong. So, I mean, sometimes I feel like a giant jerk when patients come in and their masks are on upside down or they're wearing gloves and they ask if they can have some on the way out. That's when I'll politely say, hey, your mask is on improperly. You should fix they're going to wear one, or you might as well wear one. And then they'll say, I grabbed some gloves on the way out. Say something like, you know, when I took and you were wearing your gloves, I knew that you were on your cell phone. It might not be the best idea for you to wear gloves, and this is why. I wear gloves, but I only wear gloves when I'm in contact with a patient directly, or I'm obviously like handling blood or bodily fluids or something like that is the only time that I will wear gloves. Otherwise,
So this is a good point. This is a good point. I'm going to stop recording in a couple seconds and we can continue talking. I thank you because what I'm going to do is go over with my students how to put on and take off gloves. We probably did it in the fall. I know I did it with you. And I did tell Mr. Johnson where all the gloves were in case they needed any. But I really appreciate you sharing your time with us. I know time is money, and it's your day off, so I really appreciate it. I'm proud of you. I know Mr. Dampf's proud of you too. So I'm going to stop recording now.
Okay.